I prescribed statins to over 300 patients in my career. I told every one of them it was the right thing to do. Their numbers were moving in the wrong direction. The drug would help. That was the training talking. Not one of those patients got healthier. They got managed. There is a difference, and it took me 30 years in a flight to Japan to understand it. When I landed in Okinawa in the spring of 2019, I had one question. Why do these people not get heart disease? Not rarely, not at lower rates, almost never. The Okinawa Centenarian study had been tracking this population since the 1970s, 50 years of data sitting in plain view, and the answer was never a drug, it was never a supplement, it was never a procedure, it was breakfast. The first morning I was in Okinawa, Kenji took me to visit his neighbor Fusako. She was 94 years old, she lived alone, she cooked her own meals, she had made breakfast for us. I want you to picture what was on that table. A small ceramic bowl of miso soup, steam coming off the top, a dish of pickled vegetables, maybe 3 tablespoons worth, a piece of steamed purple sweet potato, the deep violet kind you have never seen at a grocery store in Ohio, and a cup of green tea. That was the entire meal. I sat down and looked at it and thought, this is not enough. This is what a person eats when they have very little. I was wrong about that in a way that took me months to fully understand. Fusako caught me looking at the food the way a doctor looks at something that doesn't add up. She said something to Kenji in Japanese. He smiled and translated. She said, "A full stomach is a tired heart." I wrote that down. I still have the notebook. Her last cardiovascular workup, Kenji told me, had been done when she was 88. Her arterial health markers were better than most of my patients in their mid-40s. No plaque buildup of clinical significance. Blood pressure in a range I would have been proud of in a 30-year-old. She had never taken a cholesterol medication. She had never needed one. I flew home 3 weeks later and sat in my kitchen for a long time before I opened the refrigerator. What I saw in there, I had been a doctor for 30 years and I had never once looked at my own food the way I looked at it that evening. What Okinawans do for their heart is not a program you follow for 30 days and then stop. It is not a diet with a name on the cover of a book. It is a set of daily choices so old and so consistent that the people making them do not think of them as choices at all. They are simply how you eat, how you have always eaten, how your grandmother ate and her grandmother before her. Let me walk you through exactly what those choices are, because every one of them is something you can start today. The first is what they do not eat. I want to spend real time here because I think this is the part that matters most and the part that is hardest for Americans to sit with. The traditional Okinawan diet contains almost no processed food. I mean that in the most literal sense. There are no packaged meals. There are no bags of chips or boxes of crackers. There is no added sugar in the form we consume it. Not in drinks, not in sauces, not baked into bread. The pantry of a traditional Okinawan elder has perhaps 12 to 15 ingredients in it. Miso paste, dried seaweed, tofu, rice, purple sweet potato, bitter melon, which they call goya, turmeric, ginger, small amounts of fish, occasionally pork, green tea. That is the list. Now, compare that to the average American kitchen. The average American household contains somewhere between 150 and 200 individual food products at any given time. Most of them are engineered to override your body's satiety signals. They are designed by food scientists to make you keep eating past the point where your body is telling you to stop. Okinawan food does not do that. It satisfies and then it stops. That difference alone, that single functional difference between food that knows when to stop and food that does not, may explain more about arterial health than any clinical study I read in 30 years of practice. The second is purple sweet potato. In Okinawa, it is called beni imo. Before Western food arrived on the island after World War II, before fast food chains and convenience stores, this one vegetable made up roughly 60% of daily calories for the average Okinawan. Not rice, not bread, not pasta. Purple sweet potato. I want to tell you what this vegetable actually does in the body, because when I understood it, I felt embarrassed that I had never talked to a single patient about it. Beni imo is dense in dietary fiber. Fiber slows the absorption of glucose into the bloodstream. When glucose enters slowly, your pancreas releases insulin in small, manageable amounts. When glucose enters fast, as it does from white bread, white rice, sugar-sweetened drinks, most processed breakfast cereals, the insulin response is sharp, repeated, and over years, it damages the lining of your arterial walls. That damage is the beginning of cardiovascular disease, not the end, the beginning. And it starts decades before anyone feels it. Purple sweet potato also contains anthocyanins, the pigment compounds that give it that remarkable deep violet color. Anthocyanins are among the most potent anti-inflammatory compounds found in any food. Chronic inflammation is the underlying driver of arterial plaque. Lower the inflammation, you slow the plaque. The research on anthocyanins and cardiovascular health has been building for 20 years in peer-reviewed journals. Okinawan elders have been eating this vegetable every day for 1,000 years without reading a single one of those journals. They did not need to. I now eat beni imo 3 times a week. I found it at an Asian grocery store 40 minutes from my house in Columbus. It took me 2 weeks of looking. It was worth every minute of the drive. The third is Hara hachi. I need you to hear this clearly because I believe it is one of the most important things I will ever say on this channel. Hara hachi is a Confucian teaching that Okinawans adopted over 500 years ago. It means stop eating when you are 80% full. Not satisfied, not stuffed, not comfortable. 80%. Then stop. Put down whatever is in your hand and stop. Here is why this matters, for your heart specifically. When you overeat, even slightly, even regularly, even when what you are eating is reasonably healthy, your body releases elevated levels of insulin and inflammatory compounds after every meal. Do that 3 times a day for 40 years, and the cumulative effect on your arterial walls is significant. It is not dramatic, it does not hurt, you do not feel it happening, but it is happening. The reason Hara hachi works is rooted in a physiological delay that most Americans have never been told about. The signal from your stomach telling your brain that you are full takes approximately 20 minutes to travel. If you eat until you feel full, you have been overeating for 20 minutes. The food is already in, the insulin is already rising, the damage, small and invisible, is already underway. Stopping at 80% builds in that 20-minute buffer. You trust that the signal is coming, you stop before it arrives. The average daily caloric intake of a traditional Okinawan elder is somewhere between 1,100 and 1,200 calories. The average American adult consumes over 2,000. The Okinawan is not hungry. They are not restricting. They are simply eating until the work is done and then stopping. In 30 years of medicine, I never once explained this to a patient. I gave them diet sheets and calorie targets and referrals to nutritionists. Not one of them worked as well as this single sentence would have. The fourth is green tea. specifically a variety called Sanpin Cha, which is a jasmine-infused green tea that has been the primary daily drink in Okinawan households for centuries. Not water, not coffee, not juice. Green tea, multiple times a day, from morning through evening, as naturally and automatically as breathing. The research on green tea and cardiovascular health is some of the most consistent in all of nutritional science. Studies following large Japanese populations over decades have found meaningful associations between regular green tea consumption and significantly lower rates of heart disease, lower LDL cholesterol, reduced arterial stiffness, and lower blood pressure. The active compounds are catechins, antioxidant molecules, that protect the endothelial lining of your blood vessels from the kind of oxidative damage that precedes plaque formation. I switched to green tea 18 months ago. I made no other changes that month. I tracked my blood pressure every morning and evening as I always had. Over 4 months, my average systolic reading dropped 11 points. I am not claiming it was only the tea, but it was part of it, and the cost of that part was approximately 40 cents a day. The fifth is the absence of seed oils. This is the piece that most doctors will not talk about because the nutritional guidelines they were trained on actively promoted these oils for decades. I am going to tell you what the traditional Okinawan diet tells us and let you draw your own conclusions. The traditional Okinawan diet contains almost no industrial seed oils, no canola oil, no soybean oil, no corn oil, no sunflower oil in the refined, industrially processed form that fills American supermarket shelves. When fat is used in cooking, it is small amounts of lard or sesame oil. When fish is eaten, it brings with it omega-3 fatty acids that actively reduce arterial inflammation. Industrial seed oils are high in omega-6 fatty acids. The human body requires a ratio of omega-6 to omega-3 of roughly 4:1 for normal inflammatory function. The average American diet delivers a ratio of somewhere between 15:1 and 25:1. That imbalance promotes the chronic low-grade inflammation that lines arterial walls with plaque over decades. This is not fringe science. This has been documented in peer-reviewed research since the 1990s. The food industry chose not to build it into the dietary guidelines that reached your dinner table. Okinawan elders never made this mistake. Not because they read the research, because they never stopped eating the way their grandparents ate. The sixth is movement that never stops. And I want to be precise about what I mean by this because it is very different from what the fitness industry sells you. Okinawan elders do not exercise. There is no gym in Kenji's village. There is no workout schedule, no step goal on a watch, no structured fitness routine of any kind. But they are never still. They garden every morning, which means squatting, bending, lifting, walking. They walk to a neighbor's house rather than driving. They sit on the floor of their homes and rise from the floor multiple times throughout the day. Their kitchens require them to stand and prepare food from scratch for every meal. Researchers studying longevity populations now have a name for what Okinawans do. They call it NEAT, non-exercise activity thermogenesis. The caloric and cardiovascular benefit of constant low-level movement throughout the day. Study after study has shown that NEAT is more strongly associated with cardiovascular health and longevity than structured exercise. The person who walks slowly for 8 hours a day gets more cardiovascular benefit than the person who runs hard for 45 minutes and then sits at a desk for 8 hours. Okinawans have been living proof of this for 1,000 years. There is one specific movement I want to mention because it surprised me when I first read the research. Sitting on and rising from the floor without using your hands. Traditional Okinawan homes have very low furniture. Elders sit on floor cushions, eat at low tables, sleep on floor mats. They perform the motion of lowering to the floor and rising from it dozens of times every day. A study published in the European Journal of Preventive Cardiology found that the ability to sit on the floor and stand up again without using your hands or knees was one of the strongest independent predictors of cardiovascular mortality in middle-aged and older adults. Kenji does this every morning as part of his routine. He is 91 years old. I need to say something directly, and I want you to hear it as coming from a physician rather than from someone with an axe to grind. The research underpinning everything I just described has been available since the 1970s. The Okinawa Centenarian study began collecting data in 1975. It followed hundreds of centenarians, documented their diets, their movement patterns, their social structures, their daily habits. The findings were published, the data was real, the implications were clear. I was a practicing physician for 30 years. I attended conferences, I read journals, I kept up with the literature the way my training told me to, and I never once sat down and seriously studied why a population of people on a small island in Japan was not developing the diseases I was spending my career treating. That is not because the information was hidden. It was not hidden. It was published and available and sitting in research libraries. It is because my training pointed me toward treatment. Measure the number, prescribe the drug, manage the condition. Nobody in my medical education asked the question I should have been asking from the first day of practice: why do some populations never develop this condition at all? The pharmaceutical industry generates over $500 billion a year in revenue. A meaningful portion of that revenue comes from cardiovascular medications, statins, blood pressure drugs, blood thinners taken daily by tens of millions of Americans for decades. A population that eats purple sweet potato and bitter melon and stops eating at 80% full does not become that customer. I am not saying there was a meeting where someone decided to suppress this information. I am saying the funding went toward treatment, and the knowledge that might have prevented the need for treatment was never given the same resources, the same advertising, the same reach into the office where your doctor sits. I should have known this. We all should have. Fusako turned 97 last spring. Kenji sends me a photograph on her birthday every year. She is standing in her kitchen. She made breakfast that morning. Same breakfast she has made every morning for 70 years. There is no mystery to what she has done differently from the average American. There is no secret ingredient that requires a laboratory to produce. There is a purple vegetable she eats every day. There is a cup of tea she drinks every morning before she leaves the kitchen. There is a practice of stopping before she is full that she learned as a child and has never abandoned. There is a life that keeps her moving from the moment she rises to the moment she sleeps. That is the entire system. I spent 30 years looking for health in a prescription pad. The answer was on a breakfast table in Okinawa, and it has been there for 1,000 years. Here is the sentence I want you to take away from this video. The one thing I want you to be able to say to someone you love tomorrow morning. The heart does not fail because it is weak. It fails because we spent 50 years giving it the wrong fuel in the wrong amounts without ever stopping to ask why some people never had that problem. Stop eating 20 minutes before you feel full. Swap one meal a day for something closer to what Fusako eats. Replace 1 cup of coffee with green tea. Those 3 changes cost nothing. They take no willpower once they become habit. and the research behind them is 50 years deep.